I'm going to demonstrate on how to empty a closed wound drainage system. But first, we have to know the definition of wound care, a Jackson-Pratt drain, and its importance and usage. Wound care is important for wound healing. Wound care can prevent more serious complications from occurring. Wound dressings, collagen-specific enzymes, sulfa antibiotics, and antiseptics are used to prevent infection and speed healing. A Jackson-Pratt drain or JP drains are often placed in wounds during surgery to prevent the collection of fluid underneath the incision site. This is a closed, airtight drainage system which operates by self-suction. The drain promotes healing by keeping excess pressure off the incision and decreasing the risk of infection. So this is an example of what a JP drain looks like. JP drain is usually removed when less than 30 milliliters or 2 tablespoons is collected in 24 hours. We should empty the bulb when it is half full or every 8 to 12 hours. And lastly, the bandage around the JP drain should be changed once a day or more if it gets completely wet. So how do we do it? First, we have to check and verify the doctor's order. Second, we have to do proper hand hygiene. After hand washing, we prepare all the equipments needed for the procedure and bring it to the patient's bedside. We identify the patient by looking at his wristband and we explain the procedure to the patient. Once the approval has been given, we should provide privacy and dignity by locking the door and closing all the curtains. Before starting the procedure, we must do hand hygiene and apply working gloves and proper PPE according to hospital's protocol. Gently expose the incision site so that the patient won't get uncomfortable. Prepare the measuring cup for draining. Check the bandage around the JP drain if it is soiled or not. Maintaining a sterile technique, kink the tube of the JP drain before removing the plug from the pouring spout. Gently tilt away the oil from your face toward the measuring cup and pour out the drainage and compress. Draining, with the other hand, swab the surface of the port, then close the drainage system. Secure the JP drain onto the patient's gown using a safety pin. Also check for patency and the placement of the tube that must be hung lower than the wound. Note the color, consistency, odor, and amount of the drainage. Discard after according to hospital's policy. Remove gloves, perform hand hygiene, and document the procedure and findings.